Good morning for the Swedish people, ladies and gentlemen, and good afternoon for the Indian people who are participating in this webinar. We have the series of webinar we have started, and today is the first one on improving quality of the healthcare at a hospital. My name is Dr. V.K. Singh, and I'm from medical background. I'm the managing director of InnovatioCuris. This, in fact, today's webinar was supposed to be conducted by Sachin, but he got it indisposed. So I am doing for the webinar today. The InnovatioCuris is a knowledge platform which is 3 years old, which has two bodies: for-profit, not-for-profit. Conference on 5th and 6th October is Swedish participating in it. We are having a complimentary webinar, which is the series with the Swedish companies, so they understand what is the problem of Indian scenario and what they can really bring on the table to the India. We also have Innovators Club, which is also to see young innovator how to go about it. Also, we are in one of the state incubator where health domain we are looking after, that's in Gujarat. Well, we also have cyber security. We are going to roll it out in the month of September for the health people. Ministry of Defense, we are already doing it for 2 days to 4 days program. So this is what it is. And Swedish is very close to us. I was personally involved in SIDA program of the Sweden government. And ultimately, now we are taking the series so that companies can start talking, know about us, and also they know the Indian scenario. Well, I would take my privilege to introduce Josa Kare, Counselor and Head of Economic Section, who is responsible for trade promotion and economic affairs, trade policy matters, as well as promoting Sweden and cultural affairs. She also handles high-level visits within the scope of trade and economy. Well, India and Sweden, the Prime Minister had gone there and they have signed it up. We are at the middle and at the lower level to execute the wishes of those two countries so that we can take forward. I hand over to the Josa to just tell us something about on the Swedish Sea. Thank you. Josa.
Well, thank you first to the organizers, to InnovatioCuris, and to you, Dr. Singh, and to Sachin Gar for inviting me to this webinar. I would like to start by congratulating InnovatioCuris and Swecare for entering into this MOU and arranging this first event under your collaboration. As you're very well aware, Sweden and India share a long-term bilateral relations in many sectors of mutual interest. And this year, we were very happy to receive the Honorable Prime Minister, Mr. Modi, to Sweden. And we've seen some key outcomes of that, including the signing of a joint action plan and the launch of a joint innovation partnership. Within these, and also within our previous ongoing collaboration within the India-Sweden Joint Commission, health and life science are an important area of our collaboration. And with an active MOU in this area since 2009, we are very fortunate that in next year that this collaboration will complete 10 years. And I think we see a number of public agencies and also private sector actors from both sides developing key collaborations within this area. I think developments in India are extremely interesting at this point in time. We are witnessing a large shift in the composition of the health burden of India, and there, of course, from communicable to non-communicable disease. This is a process that Sweden also has gone through. And it's a global problem that requires international cooperation to handle the local implications of it. Also, I mean, we're in a position to congratulate India on the newly announced flagship health insurance scheme that the Honorable Prime Minister has recently unveiled. And such a publicly funded medical treatment is, of course, a step in the right direction, even if I am sure that the weeks and months to come will also show how the implementation process of this is to be rolled out. Quality private healthcare is one, I mean, key availability, but in remote areas it can look very different. And I think that's also something that we in Sweden can relate to, even if our scale is very different, of course. Many other issues are similar between us, so costs related to diagnostic tests and medical follow-ups, etc., and costs beyond the hospitalization expenses. But a well-implemented rollout, with that, this can be a real game changer. And I think if you go to Sweden instead, the healthcare costs have been increasing continuously, and Sweden is spending a relatively large proportion of GDP on healthcare, which in Sweden is largely tax funded in a system that ensures equal access to healthcare service. This is a cornerstone of the Swedish welfare state and widely supported. And the responsibility for health and medical care in Sweden is shared by the central government, the county councils, and the municipalities. I think the system that we use with a unique personal identity number has enabled also the digitization of health services and provides data for ongoing patient care, into use of drugs, compliance with prescribed treatment, and follow-up of outcomes on a large population scale in our context. With this, I think that national e-health and digitalization is one of the things where we can also share many experiences that we have made, and it has also enabled much of that healthcare-based innovation, together with our technology-driven environment, that can pave the way for future collaborations between smaller private sector actors, innovation companies, and startups between Sweden and India. Many Swedish medtech innovations have become global standard, and we see some interesting new companies also within this area. So the medtech are represented across the whole spectrum of the industry today. We can mention radiotherapy and imaging, especially interesting ones. And digital solutions come into play very, very closely here. With that, I would like to conclude. I mean, that these are several challenges and problems that also must be addressed in the Swedish context, but we look forward very much to the India-Sweden collaboration. And with the Swedish commitment also to the SDGs and an integrated approach where health becomes a key part of that. And I think what we can see, academia, private sector, and government agencies doing together with these issues also in Sweden, or in the Sweden-India collaboration. I think this new collaboration between Swecare and InnoHealth is an extremely interesting one, and I wish to congratulate you and wish you the best for this webinar and for this continued collaboration. Thank you so much.